What's up, everybody? Welcome back to the Move Better channel. I am your host, Dr. Joe, and this is the Professor John Penacerata. Today, we're going to be talking to you guys about the importance of thoracic mobility and how that can actually affect the shoulder or the lower back, or maybe even something below or above. So with thoracic mobility, I said this on a joint-by-joint process back in a previous episode. The way we look at the body is as a whole. We want to see if there's a dysfunctional local area, such as the thoracic spine, we might be utilizing other areas in order to compensate.
Yes,
right?
sir.
So,
yes, sir.
With lower back pain, I heard a great quote by Dr. Greg Rose when he was saying the lower back. When we talk about lower back pain, the lower back is often the victim, not the culprit, right?
Yep.
And when we think about lower back pain, it's not the reason, it's not just because you have a diagnosis there, the problem normally lies above or below. So the thoracic spine might be an issue for most people that may be causing lower back pain.
Yes.
And if we could talk about where the thoracic spine is, for those of you who don't know, come on, turn around. Thoracic spine is normally at the base of the neck right over here, normally, because some people have extra bones, but normally in the base of the neck here and where your rib cage ends, right? And then you're gonna have that little curvature here, which is your lumbar spine, but the thoracic spine is right here, and often it is a very mobile area.
Yes.
With the spine, if you look at the area of where it is, now remember, as I said, it's at the base of the neck, down to the lower back. And this is where your attachments for your ribs are. Now, even though we may think that the ribs may cause a restriction in the area when we move, if you look at the way the joints are set up at the thoracic spine, they are very mobile. This is all the thoracic spine. We can flex and extend. Now, flexion and extension in the thoracic spine is limited because of the rib cage. However, look at where most of our rotation comes from. It's from that thoracic spine. So we need to have proper extension of that thoracic spine, as well as rotation, as well as flexion. We want to make sure that the thoracic spine is as mobile as possible. So that way we can make sure that the lower back does its job in creating stability. If we look at the joints of the lumbar spine here, we don't get very much rotation at the lumbar spine just because of the way the joints are oriented. We can get some proper flexion and extension. We'll get most of that from the lower back, and we'll get a little bit more extension from the lower back as well, but not so much rotation. We'll get lateral flexion, and when we do our exams, we know when a person is utilizing their lumbar spine or their core too much when they work on rotational patterns.
Yes.
Okay? So what's so important about this thoracic spine in mobility? Well, for one, if we're talking about lower back pain, the thoracic spine, if we can utilize extension from the thoracic spine, that can allow decompression of the injuries. Like, let's say there was a disc injury,
yes,
that can help with decompression of those discs. Now remember, not all disc injuries and lower back pain are all created equal, but a lot of the time, I'm not going to say all the time, but a lot of the time, we utilize thoracic extension to help with decompression of the discs and the pain.
Yep.
We utilize McKenzie press-ups, Superman exercises to help stabilize the spine and create proprioception in the area. And then from that point, we can start increasing movement elsewhere. So now let's take you guys through some exercises that may be able to allow for less back pain or even help with shoulder mobility.
Yeah, and by moving the thoracic spine.
By moving the thoracic spine, exactly. There are a few ways to assess the thoracic spine, and in our case right now, we're just gonna do it in a seated position. There are other ways where we look at local or a global range of motion where we're seeing multi-segmental rotations from the hips and how that works with the hips and the thoracic spine. In this case, we're just going to kind of lock the hips down by by having him sit. And then from here, we're going to place his hands across his shoulders. From here, keep your knees together for me. We're just going to check, and normally I have an apparatus between his knees to kind of lock his hips in place. And then I'll check his rotation. Let's go ahead and rotate to the right. And that's kind of locked up right there, and I'm kind of helping him also. Normally I don't. And his chest, you see his head is rotating, but the mid of his chest is kind of out over here, it's less than a 45-degree angle. We're going to go ahead and rotate the opposite way here. And it's even worse on this side. So we know that John has a rotational problem of that thoracic spine. This is all we're simply going to do. We're going to increase that range of motion. This is all the stuff that you guys can do at home as well. Sit at a chair, sit at a desk. We are going to use an apparatus to have him place that between his knees. And we're going to go through a rotational. And it's a very simple exercise just to increase range of motion and mobility of that thoracic spine. So go ahead and place your hands across your chest for me, please. Take a deep breath for me, John. Inhale. Hold it for a quick second. And as you exhale, I'm going to have you rotate to the left. Let it rotate, 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 rotate. Good. And he already has a little bit more range of motion. You're going to take another deep breath. Inhale. And you're going to exhale, and you're just going to laterally flex. And as he laterally flexes, he's letting all of his air out. But now I want you to breathe into your rib cage right here. Breathe, big breaths. And so we're trying to lengthen some of the tissue in this position. And then we're just going to go right back again. This time, John, I'm not going to help you. So we're going to go back into that rotation. Go ahead and rotate to the left again. Inhale and rotate, rotate, rotate. And inhale again. And exhale, laterally flex. Breathe into that lateral recesses of the rib cage. Good. And then last one, you're going to notice how much more of a rotation he actually gets. Ready? Inhale again. Rotate a little bit further now, John. Get all the way over there. Get all the way over there. That's it. Good. And then laterally flex that shoulder down to my hand here. Now I'm giving him a lot of feedback, and because I want to increase some of his range of motion. And if you guys are listening to this or watching this, do it with us. Make sure that you guys are listening to my cues that can allow for better range of motion. Now we're going to go to the opposite way, John. Take a deep breath. Inhale. Exhale, and we're going to rotate to the right for me, please, as far as you can. Take another big breath, inhale, and laterally flex down. And you're going to breathe right into that lateral recesses of that rib cage. There you go. Back into the middle, John. No cramping, no pain, right, John?
Nope, but I'm sweating.
Yeah. One more big breath. And rotate to the right as far as you can. There you go. And laterally flex. There you go. And just naturally breathe into that lateral recesses of your ribs. There we go. Perfect. Go ahead and relax. Now, go ahead and shake it off real quick. And you guys will have noticed already that you guys have a little bit more rotation and extension of that thoracic spine. So go ahead and place that weight or the pad in between your knees again. Last check, you guys. We're just going to see if he's gained a little bit of range of motion. You're going to place your hands across your shoulders, and you're going to rotate to the right as far as you can go. That's perfect. And he is getting a little bit more range of motion in his thoracic spine. Rotate to the left for me as far as you can go. And yes, he does. Okay, so this is going to be important for shoulder and lower back. So make sure that you guys are creating that thoracic rotation to leave that pressure off of that lower back. In thoracic rotation, one of the great stretches that we do is thread the needle. But now I'm going to try to limit the amount of movement that he gets from his lumbar spine. So what I'm going to do is I'm just going to have him sit all the way back, sit your butt down onto your heels, and that's going to lock the lumbar spine, and we're going to work on thoracic rotation and extension again. Now his right hand is going to come underneath and it's going to point out towards you guys over here, and he's going to increase that range of motion, that rotation as he goes forward first. And then you're going to place your hands behind your head, place his hand behind your head, and he's going to work on that rotation and he's already adjusting his lower back, and he's rotating all the way back, and he's feeling a stretch. Let's go ahead and do the other side, John.
Yeah.
So that way we could show the camera. He's going to rotate underneath here, and you can see he's doing an anterior rotation or forward rotation of that thoracic spine. He's getting that stretch of the posterior delt, the posterior shoulder complex, and then he's going to place his hand behind his head, and he's going to work on that rotation, sitting his butt back as far as he can to keep that lock, and he's opening up his chest. Now he's stretching the anterior oblique, the pec muscle, and the anterior shoulder as he goes through these range of motion, these rotational movements. Take a deep breath, inhale, and exhale. Now it is important to note that you have to take good breaths in between all of these, because you want to lengthen the tissues of the intercostal muscles, which is in between the rib cage. And he's going to pull, and now he's going to extend and rotate backwards. if he wants to make it even more difficult for himself, he's just going to place his elbow down. Now, let's say that you guys are pretty good with that rotation and you guys just need a little bit more air in that thoracic spine. We're going to go ahead and have him do it, but he's going to make sure that his elbow stays down on the floor, and then he's going to rotate right back. Elbow down, butt down as far as he can. And look at the limitation that he has now. He's going to try to rotate, take a deep breath, inhale and exhale, and he's going to go ahead and relax. Perfect. Go ahead and relax, John.
Ooh, sweating.
Cool. So on that rotational pattern, we did the rotational patterns for the front part of the chest as well as the back on those lumbar lock rotational exercises, or thread the needles if you want to call it. The last one we want to do is just simply the cat-cow. Now you guys might have heard of it. With the stretch, we're just trying to work on spinal flexion as a whole. So we want to utilize the lumbar spine, we want to utilize the shoulders, and we want to utilize the thoracic spine. And so this is what we're going to do. We're just going to tuck our belly up as far as we can here. We're going to tuck our butt underneath us, and we're going to try to open every single joint of that spine as we go through all the way up to the neck. And notice how he's pushing his hands into the floor and he's rounding, he's pushing his shoulders away, and he's just trying to get a stretch. Now, this is the most simplest way of doing the cat stretch. Drop your chest down, drop your chest down. Now we're going to do the cow. Now you understand why they call it cat-cow. So he's still going to be, he's going to be pinching his shoulders together, and he's going to be arching his lower back the opposite way. He's going to be dropping his belly down like a cow in that position where he's dropping his belly down. He's kicking his butt up, and then he's going to do that again. Now, we can also work on utilizing segments in this position as well. So if we're trying to cue certain areas, and it is, in our case today, we're going to be focusing on the thoracic spine, I'm going to have him lock the lumbar. So he's going to sit his butt down. You're going to place your hands a little bit underneath you here. Good. And so from this position, now we're going to be focusing a little bit more on spinal flexion at the thoracic spine. Tuck your chest, tuck your chest, tuck your chest. No, you can straighten your arms a little bit more. Straighten your arms a little bit more. There you go. And then from here, keep your butt down. You're just going to arch and push. Bring your hands out a little bit further here. There you go. Perfect. And he's going to push his chest down to the floor while he's bringing his shoulder blades back slightly. There you go. And then now he's going to round out again as far as he can go. And then he can drop it back down. Now, if you need a little bit more help and you want a little bit more cueing in certain parts, like for example, if we notice where he's kind of lacking in some of that rounding is going to be a little bit higher, you can get a band and you can place a band around the top of his back. Actually, he is getting pretty good spinal flexion here. You could place a band in this area to help with a better cueing or a better feedback so you guys can know exactly what area you guys need to focus on. All right, so we got John here sweating pretty good. We want you guys to be doing the same thing. The sweating, the motion, the range of motion, the rotational patterns of the thoracic spine, the extension, the flexion, all of the above, they all help with opening up that rib cage. Now these can also help with decreasing your stress levels because now you're allowing for more oxygen and decreasing the accessory muscle utilization, which can also create even more stress when you're utilizing too much muscle in order to breathe. We're trying to open up the thoracic spine as much as possible so you can allow for relaxation. It can also help with lower back pain and help with shoulder mobility and pain.
It looks like I need some thoracic mobility.
We want to make sure that you guys know that there's so much difference, or that everybody deals with pain in a different way. This is not going to be always the answer for you. So make sure that you let us know down below. Comment, share, send it to all your friends and family.
Let's go.
We want to make sure that we help out as many people as possible. Thanks again, you guys, for joining us. We'll see you guys on the next episode.